I'm Susan Walker. I'm a cognitive behavioural therapist working as a high intensity therapist at Open Minds, which is an IAP service in Grimsby in primary care. I must admit I've not heard of co-production before today. I started doing an MRes at Leeds Beckett, and it came up as an interesting seminar to attend, which is related to where I'm working more than anything. I worked in an IAP service in Grimsby, and I do find that with time restrictions you're not particularly encouraged to build these links that would support co-production, as I've come to understand it this morning. A lot of what we've seen so far has been focusing on secondary care, where you think we would have more scope to do that. I'm in primary care, and I'm going to find out more about that this afternoon. But from my experience of working in Grimsby, I mean, I don't have time to network very much with my colleagues in psychology and community mental health team, but I am aware that they have equal amount of time restrictions on them, and they find it incredibly hard to, they're in and out helping people with medication, filling in forms, but it's very much flying visits. There isn't sort of a book you in so we can have a cup of a tea and a chat and actually get to know, and that also means that you don't have much time to develop links with services in the local area. So that you can take people and do handovers or signpost and be fully informed, really. The time just isn't there. So with it being very target driven, we often start getting a feeling of being a bit on a factory production line. And as much as these ideas I've been hearing about today, they make absolute sense. They're very encouraging if we can get people on board at the level that need to be. That's something that somebody said today, that at the top of the chain there's a lot of interest in these ideas. For somebody like myself at the bottom end, there's a lot of interest, but the people who are making the decisions, the CCGs and managing trusts and such, for whatever reason, but in the same way, when you're thinking about co-production as an idea, it's how would you quantify it, how would you be able to create an evidence base, which is what NICE guidelines, everything else needs to be based on. We understand that. I'm very evidence-based myself. But you can see the studies we've heard this morning, you can see there is an impact. It's not entirely measurable, but from perhaps a more qualitative approach, the feedback is clearly from professionals, from service users. It is working, it's a lot better for people. And you start to think, when did we ever get away really from this holistic approach, where you did look at people's social network, you did look at what opportunities they had for employment. You didn't just say, if you want to do some voluntary, go here. Somebody might find that incredibly hard to do that, even at the level I'm at primary care. So I came to be interested in co-production by accident, but now I'm very interested in it, and I'm already thinking of ways of trying to suggest it as perhaps a pilot over and back in Grimsby, where I work. And I'm already anticipating potential reasons why it might not be realistic or have the time to have a go at applying those ideas. So I'm assuming that the next time I might see of it in the workplace would be when other people who have had the time and the opportunity have done the research, and it perhaps does come filtering down as a new way of working, which would be great. So yeah, the obstacles, I think, as somebody else mentioned, we're quite stuck in our ways. We've also, in the IAPS initiative, that's something that only came in initially piloted about 10 years ago and was evidence-based. So why are they going to cause a lot of upheaval by then dramatically changing that way of working when they've put a lot of investment into it? So I'd like to see it being promoted as perhaps a way of adapting existing ways of working rather than treating it as something entirely new. And how you're going to be able to create a space, given that we're in a very target-driven number of contacts a week, payment by results environment. Are you going to be able to create space for staff to be able to do that and see the value in it, even if in a cost-benefit analysis it might not entirely be immediately justifiable, because it takes time to develop those links.